Well, you may have noticed the 2024 Paris Olympic Games got underway. I saw it. It was on TV today. So it brings a lot with it when you think of all these people coming to one place. And there are now more COVID cases popping up in France.
For more health concerns, as we talk about these things this summer, we bring in our 9 News medical expert, Dr. Payal Kohli. What are the biggest health concerns when you think about the volume of people there and, in close quarters?
I mean, after the COVID pandemic, I feel we've become so painfully aware of the health concerns of people traveling from all over the world.
The travel alone.
And, then congregating in one area and being in closed environments together. We've seen not only COVID positivity in the audience, but also amongst the Olympians as well. And that can certainly affect their performance. I would say the World Health Organization does kind of the health preparation for behind the scenes for the Olympics. And their biggest concern this year was the infectious disease impact of this, especially with that summer wave of COVID that we have. So they were encouraging people to test often. Hopefully many of these people have been vaccinated and such. But you can also imagine the climate changes. So we all saw that opening ceremony with all the rain happening. And if you're a little bit older, have chronic health problems, you're standing out in the rain. We're also hearing there's a lot of ozone and pollution at this time of year in Paris. So competing with that around. And then finally, there's always, the public health concern of terrorism or something else happening when large numbers of people gather.
Yeah, everyone's moving in buses and trains and everyone's gathering together over and over again. Let's talk about the technical aspect of athletes, Olympians, because we've already had a 28-year-old first-time Olympian test positive for a couple of banned substances.
Yes.
So, we're going to hear more about this. They're getting faster at testing. Are they getting better at testing?
They are, and I feel so horrible about this because there's such an incredible amount of pressure on these athletes to perform that one of these substances, actually, Tom, that he tested positive for is only for horses. It's not even designed for humans, and it's designed to increase muscle mass, and it's designed to increase your oxygen carrying capacity. So boost, if you're anemic, it can help boost the oxygen
How or
carrying.
why would someone have that in their system? Is that
well, so it's black market, yes. And so if you want to dope, you're not going to probably get the legal things. You're going to get the things that are available through veterinary use or other ways to really build up your system, build up your blood cells, build up your muscle mass, and use these kind of medications. And people time them so that they're out of their system when it comes time for drug testing. So I think we're getting better, but I think we still need to do better. And part of that is actually breaking this pressure on them that they feel they have to reach for these types of things.
Yeah, when you think about it, this is it. This is it. But
in swimming, they're still upset because some of the athletes who've tested positive are still not being stripped of medals.
From other countries.
You still have to have some teeth in the testing.
Well, that's true. And I think the implications and the consequences are another story. There's also was a controversy several years ago about Olympians who are transgender, who go from one gender to the other. Do they compete as men or women? Because obviously your biological gender gives you somewhat of an advantage or disadvantage, depending on which way you're transitioning. So I think a lot to think about from a medical standpoint there.
So for the athletes themselves, we think of them in perfect health. Nothing could happen to them, but the pressure of all this and everything else and pushing your body to the limit, what's the biggest risk? Is it to their hearts or what?
Well, it's funny. There's mental health pressures, as we talked about. Obviously, the stress, the anxiety, the performance anxiety. A lot of athletes take beta blockers or other substances which can help appear, but it prevents you from performing. So when it comes to a sports athlete, it's a whole level of different level of performance than, for example, someone who's a musician or someone who's singing or something else, where you can turn off up here with a beta blocker, but you shouldn't want to turn off your heart. So that's obviously one piece of it. The environmental impact, because that high ozone and grass pollen, they're concerned that a lot of athletes who might have allergies or a little bit of asthma can have problems with breathing and hyperreactivity of the airways as well when they do that. But when it comes to your heart, it's actually in better shape. So generally we have this condition called athlete's heart, where these Olympians' hearts look different than yours and my heart.
Oh yeah,
they're bigger, they're more efficient. Sometimes they dilate, sometimes they're thicker as well. Their blood vessels are different. They're a little bit different in terms of the walls of the blood vessels. The way they metabolize oxygen is different, and how much blood vessels they have around their muscles are actually different. So it's very interesting to study these people as human experiments, because what they do to their bodies, they push it to the limits, can actually translate into changes in their organs and their heart.
Tough out by those limits, that's for sure. Well, Dr. Kohli, we'll enjoy the Olympics. We appreciate your insights today, as always. Of course, you can find more with Dr. Kohli at 9news.com/Dr. Kohli.